What imaging do pancreatic cysts need for surveillance? Imagine discovering a small cyst in your pancreas during a routine scan. You might wonder what kind of imaging will keep an eye on it over time. When it comes to monitoring pancreatic cysts, doctors mainly use two types of imaging: magnetic resonance imaging with magnetic resonance cholangiopancreatography and contrast-enhanced computed tomography. Endoscopic ultrasound is also an important tool, especially if there are signs that the cyst might be more concerning. Magnetic resonance imaging with MRCP is often the first choice for surveillance. It's preferred because it doesn't expose you to radiation and provides detailed pictures of the cysts, the pancreatic ducts, and whether the cyst communicates with the main duct. This helps doctors figure out what type of cyst it is and whether it might have a higher chance of becoming cancerous. MRCP is especially useful for younger patients or those needing frequent monitoring. Contrast-enhanced CT scans are another common option. They are especially helpful if MRI isn't suitable or available. The contrast helps highlight solid parts or nodules within the cyst that could suggest malignancy. CT scans are often used initially and during follow-up visits. However, because CT involves radiation, doctors weigh the benefits carefully, especially for younger or more vulnerable patients. Endoscopic ultrasound is used when imaging shows high-risk features or if there are changes during follow-up. This procedure involves inserting a small ultrasound device into the stomach or duodenum to get a close look at the cyst. It can also allow for fine needle aspiration, where a tiny amount of fluid is taken from the cyst for lab analysis. This helps determine if the cyst is benign or has signs of cancer. How often you need imaging depends on the size and stability of the cyst. For small cysts less than 2 centimeters that stay the same for 2 years, surveillance might be stopped. Larger cysts or those with suspicious features like mural nodules or duct dilation, usually requiring yearly or more frequent scans. If the cyst remains stable over time, some guidelines suggest extending the interval to every 2 years. Using contrast during imaging is important to spot any solid parts that might be a warning sign. But if you have kidney problems or a low risk of cancer, non-contrast scans may be acceptable for routine checks. The imaging details matter too. For CT scans, thin slices and multiple phases help visualize blood flow and cyst features. MRI protocols often include special sequences to enhance the images and better see the cysts and surrounding tissue. In summary, the main tools for pancreatic cyst surveillance are MRI with MRCP and contrast-enhanced CT scans. Endoscopic ultrasound is added when there are concerning signs or changes. The choice of imaging and how often it's done should be tailored to your specific situation, considering the cyst's characteristics, your age, health, and risk factors. Always discuss your surveillance plan with your healthcare provider to ensure it's the best approach for you. Following these guidelines helps catch any early signs of malignancy while avoiding unnecessary procedures or radiation exposure.